Doctors are extremely confusing for most patients. That's not the way it's supposed to be. I get that. Ultimately, the word doctor is derived from the word dossier, which means a doctor's job is to teach and educate the patient so that the patient can make the right decision for themselves. Tragically, this doesn't happen in most Indian IVF clinics. Doctors are time starved, they're extremely busy. Some of them can be extremely rude and arrogant. And in fact, they discourage patients from asking questions. And the whole attitude is, hey, I'm the expert, just leave everything up to me and I know what to do. And when patients dare to speak up and say, hey, this is what we read on Dr. Google, doctors actually get angry and they say, well, you know what, if you read it on Dr. Google, then go to Dr. Google and get your treatment there. Very disrespectful, very rude, and that's not acceptable. After all, the patient knows there's a lot at stake, the patient is spending a lot of money, and the patient also knows that the outcome of an IVF cycle is uncertain, and therefore the patient wants this information. And it's part of a doctor's job to educate the patient and tell them what their options are, but allow them to make their own decisions. The problem is that a lot of doctors don't often have the patient's best interests at heart. And this is especially true in corporate chains of commercial IVF clinics where they're actually giving targets, revenue targets, number of cycles you need to do. As a result of a lot of these doctors say, hey, I need to care about my salary because if I don't convert at least 10 patients and do at least 10 IVF cycles, I'll lose my job. As a result of which, a lot of these doctors are now wired into selling IVF services, converting these people into IVF patients. And the reality is it's very easy to do that. Doctors spout a lot of jargon and poor patients are very scared, they're very intimidated, they're very gullible, they don't know enough. And a lot of these doctors will actually mislead patients and end up doing a lot of unnecessary IVF cycles. There's lots of over testing and over treatment because these doctors are trying to maximize their revenue rather than look after the patient's best interests, which is such a tragedy.